Hi, I'm Brandon Leonard, Director of Strategic Initiatives at Men's Health Network, and I'm here on Capitol Hill for this part 2 in a briefing series on what's happening with boys. Today we've been talking about elementary school age boys and particularly mental health, and I'm very pleased to be joined by one of our panelists, Dr. Stacia Friedman-Hill, who is Program Director in the Division of Translational Research at the National Institute of Mental Health. Dr. Friedman-Hill, thank you so much for being on the panel today, and could you tell us a little bit about your experience and maybe something that you learned?
Well, great. Thank you so much for inviting me today. It was really wonderful to have the opportunity to have such a diverse panel of people working in this field, educators and mental health specialists. I really liked hearing, since I focus so much on the basic science side of things, it really was great to hear about the challenges from the viewpoint of educators and mentors who are working with elementary school age children.
Great, thank you. And could you tell us a little bit about what translational research means, and particularly what it means in the mental health area?
I know it's kind of a mouthful. So what is translational? What are we translating? And are we translating a different language? What it actually is as an institute, we sponsor research that is at the bench, the lab bench, all the way to the bedside. And so what translational research is trying to bridge the gap between what we find in laboratory studies and identifying biomarkers that show what differences between patient groups and typically developing or healthy individuals. And then once we identify differences, we really want to characterize what mechanisms we can target as interventions. So really developing novel interventions, testing them out, and then handing it out off to our colleagues who are in the Services and Interventions Division, where they can compare established interventions and how they are delivered in the community.
I know today you spoke a little bit about brain development, particularly in elementary school age children, and we focused on boys. But I know that you have many great initiatives that you're working on at NIMH, and I just wanted to find out what are some of the things that you're most excited about in terms of your current projects?
Great. Well, thanks for asking that. So I focused a lot today on brain development and really hope that I gave a sense of how advances in technology have made new research findings possible. One of the things I'm most excited about working on is the White House Brain Initiative. I'm involved with a group that is sponsoring research for the next generation of neuroimaging. So 20 years ago, it was inconceivable that we would be able to get a picture of what's happening inside of school-age children in their brain with changes in anatomy and function and physiology. What's coming on the horizon is planning for even new methods, ways that we can delve even deeper into cellular processes, things that have portable technologies. The other thing I'm really, again, technology is the theme here. Another thing I'm really excited about is the advent of mobile health and wearable technology. And so things like the Fitbit, where you have one, great. So where people can get a measure of heart rate, their activity level, or the use of mobile phones to text people and have them respond to, well, how are you feeling right this moment? What's going on? Gives us a huge source of data from everyday life that we haven't been able to really study before. And then the last thing is, with that huge amount of data, the third thing I'm really interested in is bioinformatics. So now we're able to take data from many different sources, combine genetic data, neuroimaging data, data about transcriptomics, metabolism, and really start to integrate across different levels of investigation and really look at huge data sets where things that we weren't able to study before because they required large populations, we now are able to access that information with bioinformatics.
Excellent. Well, Dr. Friedman-Hill, we really appreciate you coming to be a part of the panel today, and thank you for talking to me for this interview, and we really appreciate your time. Thank you so much.